Hello, my name is Dr. Sai Kottapalli. I'm one of the vascular surgeons here at Vegas Vascular Specialists. And today we're going to talk about carotid artery disease. Carotid arteries are the two main arteries that carry blood from your heart to your brain. And as you age, and depending on the medical conditions such as high blood pressure, high cholesterol, or smoking history, you may form plaque within these arteries. And this is what we call carotid artery disease. When a significant amount of plaque builds up in this artery, that can cause clot formation, or sometimes some pieces of the plaque can break and travel to parts of your brain, and that can cause a major or a minor stroke. Up to 3% of the individuals older than 65 have carotid artery disease, and carotid artery stenosis and carotid artery strokes are responsible for up to 1/3 of all the strokes. In the United States, approximately 700,000 strokes occur every year, and majority of them occur in men, and in 1/3 of them it's because of the carotid artery plaque within the areas of the neck. Patients with carotid artery disease do not usually have any symptoms in the early stages of plaque buildup. Basically, vision changes, extremity weakness, or speech difficulties are the usual signs of stroke, and that could be the first sign of the condition. Many strokes, or what we call transient ischemic attacks or TIAs, are temporary and usually last several minutes to hours, and most of them go away. Whereas when we talk about major strokes, these cause permanent damage to your brain tissue due to loss of blood circulation to that part of the brain. Some of the symptoms that we associate with strokes or TIAs include weakness, numbness, tingling on one side of the body, inability to control the movement of your body parts, loss of vision or blurry vision, or as some people describe it as curtain falling in front of their eyelids, inability to speak clearly, and finally, difficulty talking or comprehending what other people are saying. When we talk about the treatment for carotid artery disease, the first step is in the management of carotid artery disease is through medications. Most patients with carotid artery disease should be on medications that control their cholesterol, and these are medications called statins, as well as antiplatelet agents called either aspirin or Plavix. And along with these, we would like the patients to be having optimal blood pressure management. Some of the surgical treatments for carotid artery disease can be explored once the optimal medical therapy is exhausted. If you have carotid artery disease that is significant, or what we call high grade, and your medical doctor may consult us as vascular surgeons for the management and treatment of carotid artery disease in order to prevent any strokes in the future. And at this time, when you go see your vascular surgeon, they may obtain a carotid ultrasound or a CAT scan of your head and neck in order to evaluate the carotid disease and for us to be able to plan for any future surgery. Based on the amount of plaque burden, your vascular surgeon may offer you several treatment options, and that could include a carotid endarterectomy or a procedure called TCAR. Carotid endarterectomy is a procedure where we make an incision along the crease of your neck and expose the artery in that area. And when we open up the artery, we then remove the plaque from within the artery while the artery is clamped, and then we close the artery after it's clean using a patch. And after the procedure, many patients go home within 1 or 2 days after the procedure. If your vascular surgeon believes that a minimally invasive approach called transcarotid artery revascularization, or what we call TCAR, is more of a suitable procedure for you, that may be offered for you. So the TCAR procedure involves a small incision at the base of your neck, right above your clavicle, and exposure of the artery in this area. And through this artery, we then perform a needle puncture and then deploy a stent over the plaque, preventing it from embolizing to your brain. And once again, after the procedure, most patients go home within a day or two of the procedure. After you are discharged from the hospital, following your carotid procedure, your vascular surgeon will follow up with you in the clinic. You will then have routine follow-up appointments with your vascular surgeon 6 months and then every year after that in order to make sure that the carotid disease is stable and has not worsened. Your vascular surgeon is also responsible for monitoring, treating, and surveilling your carotid artery disease for the foreseeable future. Please visit us at vegasvascular.com or call our office to make an appointment, or let your medical doctor know to make an appointment with us, and we'll be happy to discuss your medical problems at that time.